The Sleep, Neurobiology, Medicine and Society. Defining sleep and wakefulness. Sleep is a natural, periodical, recurring state of inactivity characterized by the loss of consciousness and reduced responsiveness of external stimuli. In contrast, wakefulness is the absence of sleep and is marked by the consciousness, awareness, and activity. The discovery of the electroencephalogram. By detecting the synchronous activity of the cortical neurons and recording voltage fluctuation in terms of amplitude of the resulting waves and their frequency, the EEG is thus used to differentiate changes in alertness and sleep stages. The natural progression of the state of wakefulness and sleep. Stage 1 of sleep, as the EEG frequency is low. Stage 1 is a brief transitional phase after wakefulness. It is followed by the Stage 2 sleep when EEG frequency is low further. During Stage 2, the episodic bursts of rhythmic 12 to 4 GHz waveforms occur in the EEG. These bursts are sleep spinless, an important characteristic of a sleep onset. Stage 2 is followed by Stage 3 and 4, which are defined by the presence of increasing amounts of high amplitude, slow, and delta wave. Wakefulness depends on the forebrain activation. Being awake depends on the discharge activity in several apparently redundant parallel ascending neurotransmitter pathways. None of these systems, which include glutamate, acetylcholine, and nomonyms like serotonin and norepinephrine, is absolutely necessary for the expression of wakefulness, but all appear to contribute. Excitatory neurotransmissions support wakefulness. The neurotransmitter system that comprise the ARAs were subsequently identified. The ascending activating system is a general term that is now more typically used. A major component of the AAS was determined by the Steroid and collaborators. Sleepiness. Sleepiness is determined by two factors. One, a homeostatic factor, depends on the duration since the last sleep both. The longer the time spent awake, the greater drive for sleep. The second factor is circadian, which varies with a 24-hour periodically and is independent of the amount of preceding sleep or wakefulness. The circadian influence is modulated through the suprachiasmatic nucleus, with inhibitory projections to components of the AAS. Here we have a video of explanation. Conclusion. The control of sleep is a complicated process that depends on the synchronization of a lot of neural and hormonal components.